Group, Dr. J. Parikh. Good morning, Jay.
Good morning, Shane.
Thank you for joining us. It's the first time that we get to talk with each other. And, you know, Dr. J, I just want to tell you, hey, I like that, Dr. J. You know, like, slam dunk this morning, Dr. J. Slam dunk, man. So I have a history of I have a heart condition myself. So I'm very familiar when it comes to heart disease, heart failure. But can you explain to us first, what is heart failure?
Thank you, Shane. So the term heart failure might sound alarming, but it's essentially a condition where the heart struggles to pump blood efficiently, or you end up retaining too much fluid in your body. So, for example, heart failure can stem from various causes. Most commonly, in a lot of people, it's a heart attack. It could also be from high blood pressure, issues with heart valves, or sometimes a weakened heart muscle. In other circumstances, it can be related to something outside the heart, such as if the kidneys are damaged. So when the heart isn't moving blood around effectively, it triggers some symptoms. Some important symptoms to look for would be shortness of breath, especially during physical activity or when lying down to rest, persistent coughing or wheezing, swelling in the legs, abdomen, or other areas, fatigue and weakness, or a rapid or irregular heartbeat. So if you suspect you have symptoms of heart failure, it's important to seek medical attention promptly for proper diagnosis and management.
Yes, for sure. Doctor, one of our questions from our listeners say, I was recently diagnosed with heart failure. What are some ways to monitor and empower myself moving forward?
That's a great question.
Yeah.
Well, I'd like to share some fundamental strategies to help monitor your heart failure and to help you take charge of your health. First and foremost, keeping track of your symptoms is crucial. Pay close attention to indicators like shortness of breath during normal activities, increased shortness of breath at night, dizziness, heart racing, and swelling in different parts of your body. Checking your legs can provide important clues. So, for example, watch for increased fluid. It usually results in soft swelling that you can compress with your finger. Another effective strategy is weighing yourself daily. So consistency is the key. You would step on the scale in the morning after using the bathroom and with your clothes off, record your weight and track it over time. So significant weight gains for us would be more than 2 to 3 pounds in a day or over 5 pounds in a week. And that may indicate that you're retaining more fluid. And moving on to diet, which I know people have a lot of questions about, sodium plays a crucial role. So limiting your sodium intake to 2,000 milligrams or less per day is advised. Sometimes, people will be on as little as 1,500 milligrams a day. And, a bowl of ramen will have about 1,000 milligrams. Ooh. So that's not as much as you think. And reading labels is important. I think people feel like they have a low-salt diet, but they'd be surprised at what they see when they start reading them. So choose fresh foods over processed ones or fast food. And focus on heart-healthy options like fruits, vegetables, lean proteins, and whole grains. And lastly, don't forget about your medications. Being on multiple medications is common, and a lot of these heart failure medications work together to support your heart. So using a pill box for organization, discussing any cost concerns with your provider, there are assistance programs out there, and bringing your medication bottles to every cardiology appointment, especially if you don't have a list yourself. Remember, staying on schedule is crucial. And any worsening symptoms should prompt a call to your cardiologist or primary care provider. Early awareness allows us to be more proactive and potentially prevent hospitalization and promoting better quality of life.
Sodium is my weakness, Dr. J, and I got to do better with that, and also my dieting. But I do know the benefits of exercise. As many may know, how does exercise affect my heart symptoms?
So exercise is a powerful lifestyle modification, which can significantly impact your heart health. The key here is finding an aerobic activity that gets your heart pumping. So not as much strength training, but aerobic for our heart patients. And for optimal results, we usually recommend engaging in this type of activity for at least 5 times a week, with each session lasting about 30 minutes. So, for a lot of my patients, especially if they have arthritis and other issues, walking is sufficient, walking around the block, walking around the park with your friends, anything like that. Now, if you have no history of heart disease the exercise intensity should be moderate to vigorous. So I expect a little bit more out of those patients. But if you do have heart disease, certainly we have to work within limits. And exercise, has to be a part of your health plan.
Yeah.
But you should consult with us, cardiology or primary care providers about how to approach it safely. And remember, everyone's health journey is unique.
Yep.
And what works for one person may not be the best fit for another. So consult with your healthcare team, tailor an exercise plan that suits your specific needs and conditions. So,
Dr. Jay Parikh, cardiologist, a great conversation with you this morning. Our first, and I look forward to talking with you again. Thank you, Dr. Jay. Slam dunk today, my friend.
Thank you, Shane, for the wonderful opportunity.